I welcome you all on behalf of Sir Mirza Ismail Nagar, Khadeem Azakhanas, and Shia Welfare Association to the Multi-Speciality Medical Camp. And our partners, especially the Narayana Hridralaya, Narayana Apollo Hospital, Netradhama, thank you very much for your support. And Who Is Hussain especially for supporting us to organize this medical camp. Our main intention is to have a pre-hub medical center in our Azakhanas association for um, for the medical needs and the financial needs of the community to help them out. So I once again welcome you all for this camp. And thank you for all the sponsors, especially also to the community doctors who are here to help us with this camp and in future as well. And the media partners, yeah, media partners are Babul Hawai's TV and the Yazehra to help us out. The Reliance School, the Crystal School, print and media partners, Dash and Dots, and the transportation partners, then the Samba Foundation for helping us organize the camp here. I thank you all of you for your support. Thank you very much. I hand over this mic to Tahire to take it forward. And Zakriya, please come.
Assalamu alaikum, everyone. Thank you so much for joining us today. Before I share my few words, I'd like Dr. Jawahar, who's the senior most doctor of our community, to please share a few words on the importance of preventive health. Over to Dr. Jawahar, and after that we will have Dr. Raza, who's doing an incredible work for the community, to share a few words.
First of all, let me tell that I am not a preventive medicine doctor, I am curative medicine. आवाज नहीं आ रहा है? Of course, for everything in medicine, it's told that prevention is better than cure. So definitely I will agree with Dr. Zakaria that preventive medicine is very important. Prevention. If you prevent the disease, there is no need to go for a curative medicine, isn't it? I think enough on that, okay?
I am Dr. Raza. I'm basically a pediatrician, but I usually come across adult patients too. So regarding preventive health, with regards to pediatrics, I would tell everybody that preventive health in pediatrics starts from pregnancy, not after the childbirth actually. So it is up to the mother to take care of her health, including her nutrition, sleep, rest and all, so that she delivers a healthy baby, so that pediatricians don't have much work to do. This is one thing. Second thing here, my takeaway message is, see, we have a lot of volunteers here, more than the patients. So I'd like to tell the volunteers that whenever you are coming into the coming in contact with the medical fraternity or coming to help here, be a part of the medical fraternity. Like for example, volunteers don't restrict your work. For example, a lab technician who's given a duty of testing blood, he should be very careful that if any abnormal things are there, they should immediately get in touch with the doctor. So should be a coordination. If a helper is there or some person come across some emergency somewhere, don't think that I'm a volunteer, I cannot do anything. So there's a lot of coordination should be there between the volunteers, because many of the volunteers are sitting here between doctors and volunteers. In fact, doctors may not come across many things which you all come across. So please be in touch with any of the doctors, not here, in your day-to-day life also, because once you become someone connected to medical fraternity, people will expect many things from you. So wherever I go, I tell that once you come into the circle of medical profession, including doctors, you may be a small health worker also, but you have a big responsibility too. This is one thing more than Thank you very much.
Without taking much time, okay, when we stress on preventive health, like Dr. Raza mentioned, we have more volunteers today, okay, and we need to tell our community that we're doing this for you, correct? And today, as you're sitting here, please take this opportunity to call your family and friends, make the best use of the opportunity. You know, and we have to take an oath today that we will not give up on our community. Even if 50 people turn up today, we will be very happy. So we have decided to do a medical screening camp every 3 months, inshallah. And thank you so much for all the volunteers and SMI and Azakhana associations for giving us a platform. You know, I think, alhamdulillah, we all have come on one platform. We have Narayana Health, who has been very kind enough to give a mammography van. A Volvo bus is stationed there. And you know, a lot of ladies in our community, they react late. So breast cancer is one of the most common occurrences in, in a woman. So if you know any lady, please encourage them to get themselves tested. This is a very good opportunity. And when we speak about preventive health, the age-old saying, prevention is better than cure. Especially after the COVID pandemic, there are a lot of misinformation. A lot of people think people are dying suddenly, but actually there is some, they have some health issues. Similarly, that's the reason we all have come together. We have pediatric department set up in the first floor. Please encourage people and the children to please get them tested. And we have a cardiology department which follows up after basic screening. We have ECG for the ladies and the gents. And we have an orthopedic department, physiotherapy, especially for the ladies. They say, hata pawa mein darad ho raha hai, right? So we have a lady physiotherapist at your service. Take their services. We have bone density testing, BMD testing. We have Netra Dhama, who's been very kind enough to set up beautiful, eye cataracts. They're going to give their services for cataract surgeries. We have Dr. Haider Abbas, ophthalmologist, who's going to help us also. And in the basement, we have a gynecologist who has come down to cater to all your, gynecological needs. We have Apollo Dental, who's come down to check up. And of course, they have been very kind enough to do subsidized fillings at just, I think, 300 rupees. If you have any fillings requirement, you can please go in the basement. We have Dr. Salman Haider, who's going to cater to dermatological needs. We have a urology section. We have ENT section. Okay, and we also have a nursing station downstairs as well. So if we feel there's overcrowding here, we request the volunteers to please, maintain the flow of the patients. Okay, as you're sitting here, I know this is Jummah, and this is a very important day for all of us. We're expecting more crowd after the Jummah prayers, but please use your WhatsApp, your social media to encourage a lot of people to come. I'm sure we're all spread across Anepalya, Nilsandra, Austin Town. Please make this opportunity to help us make this camp very successful. And Narayana Health is also offering us a 25% discount on follow-up diagnostic tests, along with 10 to 15% discount on inpatient, whoever we refer to them from your SMI association. Inshallah, the SMI card, make sure the card is given to every patient. The moment they show their card in Narayana Health facility, inshallah, they will cater to our needs. Apart from that, this is a hybrid camp where it's a community doctors-led camp. We have senior doctors here who have supported us, and inshallah, wherever we need to fill the gaps, they're here to fill the gaps. Over to Ms. Tahire, who will probably speak on the pre-care hub set up for the community.
Assalamu alaikum. I would like to first of all, start thanking the doctors, the senior doctors, the junior doctors, the medical reps, the pharmacists, the radiologists, each and everybody. Thank you very much, doctors. Thank you very much, all of you, for making this happen together. I must tell you that we just started off with a list with Inayat. We started calling the doctors, and then the doctors came together, and the horsepower was Who Is Hussain, and all the idaras put together. I would like to read out the list of list of partners who have helped put this together, first of all. So the whole overall camp is organized by the Sir Mirza Ismail Nagar, Shia Welfare and Khadeem Azakhanas associations, who has a very long-term vision in taking the medical facilities and, and addressing the financial instabilities of the community. So reading out to the health partners who have joined hands today. So the health partners are Narayana Health, Apollo Dental, Netradhama, Eye Super Speciality Hospital. The logistics partner is the Sambhav Foundation. Giving you a little brief about Sambhav Foundation. Today and tomorrow, Sambhav Foundation is taking the overall ownership of the organizing, the ensuring that every community member does hold a government-backed scheme. Plus, also there are insurance desks. Signa Manipal is here. With their support, we are trying to see what best and how best we can give every household of the community a medical insurance to ensuring financial stability. Then we have, so Sambhav's team is here, who is taking down all the details to ensure that even there will be a follow-up tomorrow with a Bangalore one team coming here, ensuring each and every household has got all the government backup required. Yeah. So then we have the transportation partners, which is the Reliance Public School and the Crystal School, who have given us their transportation to accommodate areas starting from Electronic City, Sharjapur route, the whole of Ijipura, Anapalya, Victoria Layout, Austin Town, Vivek Nagar, plus Shanti Nagar, Richmond Town. The whole coverage is given with rotational transportation. Then coming to the print and design partners, I would like to name Dash and Dots, who is the corporate partners of the association, who has helped us with all the print facilities. Now, not missing out on the collaboration partners of all the community idaras, starting with Anjumane Imamia, Anjumane Shia Khabristan, Shia Masjid and Khabristan Committee, Idara Faizul Islam, Azakhanas of Yashwantpur, Anjumane Zehra, Anjumane Sogra Trust, and nevertheless, Who Is Hussain, who has played a very vast role. We have overall coverages in the services consultations today is general physician, internal medicine, cardiology, orthopedic, ophthalmology, I don't know these terminologies, excuse me. Pediatric, we also have, when we talk about pediatric, we have pediatric oncology with general practitioners and pediatric neurology as well. Correct? Yeah. Then we have dermatology, we have ENT, general surgeon and practicology, physiotherapy and urology. So in various medical services, we have vitals, BP, pulse, body mass index, GRBS, ECG, BMD, breast cancer screening as the mammography Volvo buses here, and also a few tests. We have allied services, the insurance desk, and the government-based schemes. We request the community to please come forward. We still have, we have a large audience already, alhamdulillah. We're looking forward and we are ready to cater to 1,000 to 1,500 people today with repeat sessions. And again, before I close my conversation, I would like to thank each one of us. Yeah, thank you. Each one of us, especially the doctors, especially all the doctors who have come together. Now, just before I step down, the most critical, the long vision is the pre-care hub. We have introduced pre-care hub as of today. What is pre-care hub? Pre-care hub is an association. It is supported by all the community doctors to attend to pre-care medical treatment consultation. When I say pre-care medical treatment consultation, it is not a clinic. We've not opened a clinic, but we have opened a pre-care hub, which is catering to pre-care medical treatment, where it is going to be a centralized lobby. Now, in this medical camp, the doctors will diagnose, write down the investigation basis the pre-medical history. And then we will close the loop in the exit desk, note down all the diagnoses, and this will be carried and recorded taken over by the pre-care hub, which our doctors, we have a doctors, all doctors minds circle, who will be running this pre-care hub. It will only be backed by the idaras. The idaras will only back it, but it is completely the initiative of the doctors who will take charge, and they will run this hub, and with non-interference of non-professional practitioners. They will ensure that everything, all the immediate requirements, SOS requirements are taken care of. End of the day, it will be the decision of the doctors. Correct, doctors? Yeah. So we request the community to please come forward, take this initiative as much as to their benefit, and take it forward in collaboration. Thank you very much. Doctor, would you like to close?
الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الصلاة والسلام على محمد وآل محمد या मन इसमुहु दवा व ज़िक्रुहु शिफ़ा। मोमिनीन इकराम, वाक़ईन हमने चाहा कि आए यहाँ पे एक कैंप का जो मंज़र है उसको देखा जाए अपने आँखों से, तो वाक़ईन जो ख़याल से बाला रहा यहाँ का जो इंतज़ाम है और तमाम डॉक्टरों ने मिल के जो काम किया है, बहुत ही अच्छा इंतज़ाम किया है। और गुजारिश है कि बजाय इसके कि इंसान आखिरी वक्त तक इंतज़ार करे और इमरजेंसी के वक्त निकाले स्कैन्स और ये तमाम चीज़ें, उससे पहले ही ये प्री एक हेल्थ हिसाब रखा है, इसको पहले ही आए चेकअप करे और अपना पहले से ही बीमारी की पहचान हो जाएगी, तो एंड आखिरी वक्त में जाके उसका इलाज मुश्किल हो जाता है। अगर पहले ही पता चल जाए तो उसका इलाज
और आज जुमे का दिन है और आप देख रहे हैं कि बहुत से लोग आ रहे हैं बड़ी तादाद में। और जस्ट टू स्पीक अबाउट द बैकग्राउंड, हम रजिस्ट्रेशन के बाद बेसिक स्क्रीनिंग करेंगे, जिधर GRBS जो डायबिटिक्स जो जिसे भी डायबिटीज़ हैं उनको ऑन स्पॉट डिटेक्ट करेंगे कि अगर ब्लड शुगर लेवल ज़्यादा है, अगर ज़्यादा है तो क्या क्या गाइडेंस करना। ये लाइफस्टाइल डिसऑर्डर है, बहुत से लोगों को पता ही नहीं कि उनको डायबिटीज़ है, और डायबिटीज़ कैन बी कंट्रोल्ड विद द राइट लाइफस्टाइल। अपार्ट फ्रॉम दैट वी हैव अ टीम टू चेक द ब्लड प्रेशर, बिकॉज आपको पता है ब्लड प्रेशर अगर आप कंट्रोल किए तो आपका हार्ट और आपका माइंड बहुत क्लियर रहेगा। द लीडिंग कॉज ऑफ डेथ टुडे इज स्ट्रोक एंड कार्डियक प्रॉब्लम्स। हार्ट प्रॉब्लम और स्ट्रोक जो है डायरेक्टली कनेक्टेड टू द हाई ब्लड प्रेशर। उसके बाद हमारे जनरल फिजिशियंस हैं कम्युनिटी के, उनके बाद कार्डियोलॉजिस्ट ओपिनियन लेंगे, और ECG का भी इंतज़ाम है। आप देख रहे हैं फीमेल्स के लिए सेपरेट रूम का इंतज़ाम है, मेल के लिए ECG का इंतज़ाम है। वी हैव आई हॉस्पिटल नेत्रधामा मल्टी स्पेशलिटी हॉस्पिटल हु हैज़ कम हियर टू स्क्रीन अस। बहुत से लोगों को कैटरैक्ट है, लेकिन कैटरैक्ट के बाद कैसा हम लोगों को ट्रीट करना। सो वी हैव नेत्रधामा हु इज़ हियर टू गाइड अस। We have orthopedic consultant from Narayana Health City. We have BMD, bone density. जो लोग बोलते हैं पैरों में दर्द है, क्यों है दर्द? Because of the density of the bone. So we have that as well. Apart from that, we have gynecology for the ladies. We have a gynecologist from Narayana Health City जो gynecological needs को cater कर रही है. We have dentistry support by Apollo Dental जो फ्री में एक्सट्रैक्शंस कर रही है, फिलिंग्स। एंड वी हैव अ डर्माटोलॉजिस्ट, वी हैव ENT डॉक्टर, वी हैव अ यूरोलॉजिस्ट, एंड एज यू सी इट्स अ मल्टी स्पेशलिटी कैम्प। द पर्पस इज लोगों को स्क्रीन करना कौन सिक पेशेंट्स हैं, और हमारा रियल काम ये कैंप के बाद शुरू होता है। वी हैव संबर फाउंडेशन, टीम फ्रॉम संबर फाउंडेशन हु हैव हेल्प डेस्क्स एट गवर्नमेंट हॉस्पिटल्स। बहुत से लोग गवर्नमेंट हॉस्पिटल को जाते हैं बट उनको गाइडेंस नहीं मिलता, so we have a desk from Sambhav Foundation who will guide our patients towards the right treatment. And from Narayana Health, we have special discounts only for our Shia community, up to 25% from all your diagnostic tests, 15% for all the inpatient admissions, or they have discounts up to 45 patients. So I have discussed with my team to cater to our Shia community, which is just around the corner. Now I'd like to call upon Dr. Intizar Mehdi, who is a senior pediatric hematologist and oncologist consultant, who is an expert in bone marrow transplantation. बहुत से cases हमको आते हैं BMT के लिए, जो packages बहुत बड़े होते हैं. So we have an expert among us who will also speak on preventive health. Over to Dr. Intizar Mehdi. Please share your valuable words with our community. And moving ahead from us, I would also like to stress on Pre-Care Hub after his speech.
Assalamu alaikum. Dr. Zakaria, thanks for that introduction. I think सबसे पहले मैं SMIN ग्रुप का जो है शुक्रगुजार हूँ जिन्होंने कितना अच्छा प्रोग्राम यहाँ पे ऑर्गेनाइज़ किया है और इसके साथ साथ हमारे सारे अंजुमन बैंगलोर के जितने भी अंजुमन हैं इसमें सब लोगों ने आगे बढ़ के जो है सपोर्ट किया है और उसके साथ हू इज़ हुसैन फाउंडेशन जो है जिसके रिप्रेजेंटेटिव डॉक्टर ज़करिया यहाँ पे हमारे साथ है, उन्होंने भी इनका साथ दिया है। तो ऐसे तो हमारी कौम में सारी अंजुमन, कभी अंजुमन इमामिया, कभी मस्जिद अस्करी ख़बरस्तान कमेटी, कभी दारा फैज़ुल इस्लाम और बाकी बहुत सारे अंजुमन ने इससे पहले भी बहुत बार हेल्थ कैंप किया है और बढ़ चढ़ के मेडिसन, सर्जरी, गायनेक, पीडियाट्रिक सारे स्पेशलिटी को डॉक्टर्स को बुला के कोशिश करते हैं कि हमारी कौम के लिए किस तरह की मदद हो सकती है। तो इस कैंप की स्पेशलिटी क्या है, हम लोगों ने ये कोशिश की है कि एक्चुअली होता ये है कि हमारी कौम के जो लोग हैं, एक तो जो डॉक्टर ज़करिया बता रहे थे प्रिवेंटिव हेल्थ, मतलब सेहतमंद कैसे रहना है, ये भी एक हुनर है, एक आर्ट है। तो क्या करना चाहिए और क्या नहीं करना चाहिए उस पर हमारा बहुत ज़्यादा फोकस है। तो लाइक दे से प्रिवेंशन इज़ बेटर देन क्योर, मतलब बीमारी को आने से ही बचाना बेहतर है। बीमारी आने के बाद ट्रीटमेंट कर सकते हैं, लेकिन अगर बीमारी को हम बचा लें, बीमारी आने से बचा लें तो वो बेहतर है। दूसरी चीज़ ये है कि कौम में कई लोग ये होता है कि कोई प्रॉब्लम आता है, समझ लीजिए ऑर्थोपेडिक का प्रॉब्लम है, गायनेक का प्रॉब्लम है, कैंसर का प्रॉब्लम है, लोग मारे मारे दर बदर इधर उधर कई हॉस्पिटल जाते हैं, कई जगह का एस्टिमेट लेते हैं, फिर समझ में नहीं आता है कि एक्चुअली कहाँ करना चाहिए, कहाँ दिखाना चाहिए। कई बार हमारी कौम में ही नहीं, सब लोगों में मतलब वो छुपाने की एक वो रहता है कि ऐबदार बीमारी तो नहीं है, किसी को पता चल जाएगा तो क्या करेंगे। तो लोग जो कोशिश करते हैं कि बीमारी को छुपाएं, नहीं बताएं, तो कौम के डॉक्टर्स को आके नहीं डिस्कस करते हैं। कई बार ये होता है कि बीमारी बहुत आगे बढ़ जाती है, जब लाइलाज हो जाती है तब लोग आके पहुंचते हैं और फिर बताते हैं कि भाई अब क्या करें, अब डॉक्टर साहब आप मतलब बीमारी से बचना कैसे है इसके ऊपर फोकस कर रहे हैं। दूसरे जो बीमार हैं उनको हमारी जो ग्रुप की सर्विसेज है वो हम कोशिश ये करेंगे कि हम सब मिलके हमारे फील्ड में अल्हम्दुलिल्लाह 40-45 डॉक्टर्स हैं हमारी कम्युनिटी में अल्हम्दुलिल्लाह, और ऑलमोस्ट सारे स्पेशलाइजेशन के डॉक्टर्स हैं। तो हम एक कोर ग्रुप बना के कोशिश करेंगे कि एग्जांपल ये कैंसर का मरीज़ है तो ये कहाँ जाना चाहिए, ये हार्ट का मरीज़ है तो कहाँ जाना चाहिए, ऑर्थोपेडिक का मरीज़ है तो कहाँ जाना चाहिए, इस तरह की कोशिश। उसमें ये होगा कि एक तो इलाज अच्छा होगा, कोशिश करेंगे कि इलाज अच्छा हो। दूसरे कोशिश ये करेंगे कि जैसे फॉर एग्जांपल डॉक्टर ज़करिया ने यहाँ पे जो है नारायणा से हमारा जो है टाई अप है, नेत्रधामा, ऐसे 2-3 हॉस्पिटल हम कोशिश करेंगे कि और थोड़े हॉस्पिटल से हमारा टाई अप हो, जहाँ हमारे कौम के लोग जाएं तो सिर्फ ये नहीं कि सही इलाज मिले, इसके साथ साथ इलाज में डिस्काउंट मतलब कम रेट पे थोड़ा मिले फोकस, और हमारे पर एक होल्ड भी रहेगा, हम कंट्रोल भी कर सकते हैं कि भाई हमारे बंदा यहाँ पे इलाज कर रहा है तो हम वहाँ के डॉक्टर से कोऑर्डिनेट कर सकते हैं कि क्या चल रहा है, कैसे नहीं चल रहा है, ये सब है। तो इस तरह का हमारा फोकस है, थोड़ा सा डिफरेंट है ये कैंप। ऑफकोर्स हम सर्विसेज तो दे रहे हैं, स्टार्टिंग फ्रॉम जनरल चेकअप, सारे स्पेशलाइजेशन, ECG, को मैमोग्राफी, बहुत सारी चीज़ें हो रही है, गायनेक, पीडियाट्रिक्स, बट हमारा फोकस प्रिवेंटिव हेल्थ पे है। आखिरी में मैं 2-3 बात कहना चाहूँगा, ख़ास करके अपने कौम वाले लोगों के लिए, कि ये जो कैंसर है, ये बीमारी के बारे में हम सुनते ही जाहिर सी बात है कि हम सब डर जाते हैं। कैंसर का मतलब इक्वल टू डेथ, ऐसा हम समझते हैं, लेकिन अल्हम्दुलिल्लाह साइंस ने इतनी तरक्की अब की है कि कैंसर इज़ नॉट इक्वल टू डेथ। इसका मतलब ये है कि अगर बड़ों में कैंसर होता है, अगर अर्ली स्टेज में हम उसको पिक कर लें तो अल्हम्दुलिल्लाह बहुत सारे लोगों को कंप्लीट क्योर हो सकता है, कंप्लीट क्योर कर सकते हैं। बड़ों में लाइक अ हैंड ऑफ दिस थिंग, बट लेडीज़ में ब्रेस्ट कैंसर, यूट्रस, सर्वाइकल कैंसर ये ज़्यादातर होता है, और बड़ों में लंग कैंसर, स्टमक कैंसर, प्रोस्टेट वगैरह होता है। लाइफस्टाइल इसमें बहुत इंपॉर्टेंट रोल प्ले करती है, जैसे कि गुड लाइफस्टाइल, फॉर एग्जांपल स्टेइंग अवे फ्रॉम स्मोकिंग, अल्कोहल अल्हम्दुलिल्लाह हमारी कम्युनिटी में इतना प्रॉब्लम नहीं है, लेकिन फिर भी उसको मेंशन करना पड़ेगा। जंक फूड, अवॉइडिंग ओबेसिटी, फिर जंक फूड वगैरह खाना, जिसके में ये फास्ट फूड और ये कोल्ड ड्रिंक, सॉफ्ट ड्रिंक वगैरह सब इंक्लूडेड है, हेल्दी लाइफस्टाइल, वॉकिंग वगैरह। और रेड फ्लैग्स जो होते हैं, अर्ली साइंस ऑफ कैंसर, अनएक्सप्लेन्ड फीवर बहुत दिन तक, वेट लॉस, या उसके अलावा कोई ऐसा सिम्टम जैसे कि बॉल मोशन, जैसे टॉयलेट का फ्रीक्वेंसी चेंज हो गया, ब्लीडिंग आ रही है, बॉडी में कहीं स्वेलिंग नोटिस हुई है, जो स्वेलिंग ठीक नहीं हो रही है, ये सब रेड फ्लैग्स हो सकते हैं। औरतों में फॉर एग्जांपल मेंस्ट्रुएशन की जगह पे पीरियड्स में वेरिएशन होना, या ब्रेस्ट में कोई मास नोटिस करना, ये सब कैंसर के अर्ली साइंस है। बच्चों के कैंसर में, जिसमें मैं माहिर हूँ अल्हम्दुलिल्लाह, वो अलग टाइप के कैंसर होते हैं, ब्लड कैंसर, ल्यूकीमिया, लिम्फोमा वगैरह, उसमें अर्ली साइंस भी इसी तरह के सटल होते हैं, लेकिन इसमें लाइफस्टाइल का कोई रोल नहीं है। बट ऑल इन ऑल बच्चों के कैंसर कम्प्लीटली क्यूरेबल हैं, तकरीबन 80% बच्चों में कंप्लीट क्योर हो जाता है, प्रोवाइडेड सही डायग्नोसिस, सही वक्त पे उसका सही इलाज हो जाए तो फिर हो सकता है। और बोन मैरो ट्रांसप्लांट, जो कि हमारे ख़ास करके अलीपुर में हमारे बहुत लोग थैलेसीमिया के मरीज़ हैं, उसमें बोन मैरो ट्रांसप्लांट से कम्प्लीटली क्योर कर सकते हैं। तो हम सारे भाई यहाँ पे आप लोगों के लिए मौजूद हैं, भाई और बहनें, हमारे डॉक्टर्स वगैरह, हम कोशिश कर रहे हैं कि अपनी कम्युनिटी को किस तरह से हम आगे हेल्प कर सकते हैं। वस्सलाम।
Now we have a short speech by Dr. Zaheen, who's a pediatrician, developmental pediatrician, and inshallah she will share a few words on how to cater to the young stars of our community. I think the future of our community are the young children. How do we keep them healthy? And also she will share a few words on preventive medicine. Over to Dr. Zaheen.
Assalamu alaikum. Assalamu alaikum. My name is Dr. Zaheen Zahra. I am a pediatrician by profession. मैं पीडियाट्रिक्स के बाद मैंने स्पेशलाइज किया है डेवलपमेंटल पीडियाट्रिक्स में, जो बोल सकते हैं सॉफ्ट न्यूरोलॉजी होता है। तो जैसे डॉक्टर ज़करिया बोल रहे थे प्रिवेंटिव मेडिसिन के बारे में बात करना है, तो मैं थोड़ा अर्ली इंटरवेंशन के बारे में बात करूँगी, जो मेरे फील्ड में बहुत इंपॉर्टेंट है। जो जब एक बच्चा पैदा होता है कुछ कर नहीं पाता, लेकिन एज द चाइल्ड ग्रोज, गर्दन खड़ी होती है, बैठता है, उठता है, पलटता है, बात करने लगता है, तो ये सब एज अप्रोप्रिएट ग्रोथ होता है या डेवलपमेंट होता है या विकास होता है हर बच्चे में। ऐसे डेवलपमेंट के काफ़ी डोमेन्स हैं, ब्रॉडली 4 बोल सकते हैं, लेकिन डिटेल में जाएंगे तो 6 to 8 डोमेन्स होते हैं डेवलपमेंट के। तो अगर कोई बच्चा अपने एज के हिसाब से ग्रो नहीं करता डेवलपमेंटली, हाइट वेट की बात नहीं कर रही हूँ मैं मेंटल बात कर रही हूँ और फिजिकल डेवलपमेंट की बात कर रही हूँ, वो जब नहीं करता उसको बोलते हैं डेवलपमेंटल डिले। अगर बोलिए एक बच्चा अभी 6 मंथ्स का है और वो बैठ नहीं पाता है, तो थोड़ा यू हैव टू बी वेरी केयरफुल एंड थोड़ा डॉक्टर के पास बताना रहता है। तो आप जितनी जल्दी डॉक्टर के पास ले जाएंगे वो बच्चे को और बताएंगे, इतनी जल्दी हम लोग अर्ली इंटरवेंशन शुरू कर सकते हैं। तो ये अर्ली इंटरवेंशन होता क्या है? अर्ली इंटरवेंशन एक मल्टीफैसेटेड थेरेपी होता है, जिसमें आपको ऑक्यूपेशनल थेरेपी इन्वॉल्व रहता है, फिजियोथेरेपिस्ट इन्वॉल्व रहता है, स्पीच थेरेपिस्ट इन्वॉल्व रहता है, एंड साइकोलॉजिस्ट इन्वॉल्व रहते हैं, और जनरल पीडियाट्रिशियंस इन्वॉल्व रहते हैं, और डेवलपमेंटल पीडियाट्रिशियंस का तो मेन रोल इसमें रहता है। तो अगर कौन से बच्चों को आपको एक्चुअली इसमें स्क्रीन करना चाहिए, काफ़ी बच्चे रहते हैं, जैसे प्रीटर्म बच्चे होते हैं जिसका जन्म टाइम से जल्दी हो जाता है, या जो बच्चों का वेट ज़रूरत से ज़्यादा कम रहता है, या जिसका NICU स्टे रहता है, जो ICU में रखा जाता है, जो बच्चा जन्म के बाद रोता नहीं है, तो ये सब हाई रिस्क बच्चों में आ जाता है। या जिस मदर को बुखार होता है प्रेगनेंसी के टाइम पे, तो ऑल दीज आर हाई रिस्क चिल्ड्रन। तो इन बच्चों में आपको और बहुत केयरफुल रहना चाहिए। तो आपके रेगुलर पीडियाट्रिशियन के पास बताना चाहिए। अगर कुछ उन लोग और पूछना चाहिए कि बच्चों का डेवलपमेंट कैसा है। अगर उनको लगता है कि डेवलपमेंट में कुछ प्रॉब्लम रहता है, तब यू हैव टू टेक द चाइल्ड टू डेवलपमेंटल पीडियाट्रिशियन। तो ये एक हो गया अर्ली इंटरवेंशन इन केस ऑफ डेवलपमेंटल डिले। तो दूसरा हमारा सबके यहाँ शायद बच्चे होंगे, एक और है समथिंग फॉर लर्निंग डिसेबिलिटी, जो हम लोग बहुत देखते हैं। लर्निंग डिसेबिलिटी एक ऐसा फील्ड है जिस बच्चों में कोई डेवलपमेंटल प्रॉब्लम नहीं होता है, लेकिन सिर्फ पढ़ने लिखने में काफ़ी प्रॉब्लम होता है। इन बच्चों को बोलते हैं लर्निंग डिसेबिलिटी के बच्चे। अभी डिटेल में नहीं जाते, सिर्फ ये ध्यान रखिए अगर 8 साल के बच्चों में कुछ भी अगर वो सही से लिख नहीं पाता है, पढ़ नहीं पाता है या मैथ्स नहीं कर पाता है, तो इसका ये मतलब नहीं है कि ये सुस्त है, ये पढ़ता नहीं है, ये बहुत खेलू बच्चा, ऐसा नहीं है। इन बच्चों में स्क्रीनिंग करना ज़रूरी हो जाता है लर्निंग डिसेबिलिटी के लिए। तो ये स्क्रीनिंग जितना हो सके जल्दी करना चाहिए। आइडियल एज होता है 8 ईयर्स। 8 ईयर्स मतलब स्कूल ज्वाइन करके 3 साल बाद। तो ऐसे बच्चों को लेके जाइए, ज़रूरी होता है थेरेपी करना। और थेरेपी करने का ये फ़ायदा हो जाता है कि अगर ये बच्चों को लर्निंग डिसेबिलिटी का कुछ सर्टिफिकेट मिल जाता है तो गवर्नमेंट से ही काफ़ी आपको ये प्रोविजंस मिलते हैं, जैसे 20% ग्रेस मार्क्स मिलते हैं, 20 मिनट्स का एक्स्ट्रा टाइम मिलता है, ग्रामर और ये अल्फ़ाबेट्स और स्पेलिंग्स चेक नहीं किया जाता है। तो ये भी हो गया एक अर्ली इंटरवेंशन। तो जितनी जल्दी हो सके, अगर आपके बच्चे में कुछ पढ़ने लिखने की प्रॉब्लम है तो इसके लिए भी डॉक्टर्स हैं जो आपको हेल्प कर सकते हैं। तो और एक और इम्पॉर्टेंट टॉपिक हो गया डेवलपमेंटल पीडियाट्रिक्स में ऑटिज्म, जो आपने सब सुना होगा ऑटिज्म के बारे में। ऑटिज्म भी बहुत जल्दी, जैसे कि 2 मंथ्स ऑफ एज से ही हम लोग डायग्नोज कर सकते हैं। ये बच्चे जल्दी स्माइल नहीं करते, जो बोलते ही रहते हैं और हाथ पैर हिलाते ही रहते हैं। जैसे आपने सब देखा होगा माय नेम इज़ खान में शाहरुख खान जिसका ऑटिज्म है, तो वो आपको एडल्टहुड तक वेट करने की ज़रूरत नहीं है, जितनी जल्दी हो सके ये डायग्नोज कर सकते हैं। एक सिंपल एग्जांपल बोल सकती हूँ कि यूएस में ऑटिज्म 5 बच्चों में 1 बच्चे को ऑटिज्म होता है, लेकिन इंडिया में 100 बच्चों में 1 बच्चे को ऑटिज्म है। इसका मतलब ये नहीं है कि इंडिया में ऑटिज्म कम है, इसका मतलब ये है कि इंडिया में डायग्नोज नहीं हो रहा है। तो अगेन अर्ली इंटरवेंशन ज़रूरी है, जितना हो सके जल्दी अपने बच्चों को कुछ भी प्रॉब्लम लगे, इरिटेबिलिटी है, सही से आँख में आँख नहीं मिला रहा है, बोल नहीं रहा है, 3 साल तक बोल नहीं रहा है, 2 साल 3 साल तक चल नहीं रहा है, अपनी एडी उठा के चल रहा है, ये सब साइंस ऑफ ऑटिज्म हो जाते हैं। तो ऐसे ही मत छोड़िए, डॉक्टर के पास ले जाइए, प्रॉपर हेल्प लीजिए। हम तो यही है, वहाँ पर है ही, तो कभी भी कॉन्टैक्ट।
On behalf of Mirza, Ismail, Khadeem, Azakhanas, and Shia Welfare Association, I thank you all for your participation and your support, especially the doctors who did all the people in this school that is possible, and the volunteers because you also this school that is possible too. And I would like to thank Nagar Health and Multi-Speciality and Apollo Medical, and also the logistic partners, Nagar Foundation, and all the others for the community who supported us to make this grand success. I think we had approximately about 300 plus the people attending the program, and we look forward to a bigger next time school, maybe in another 3 months or so. And I would request all of you to kindly participate in inauguration of the Rehab Center in our Azakhanas office. We are supposed to run at 5 o'clock. We make it about 5:15. We can all reach there and do the inauguration of the center. I also thank the media partner, and also the Mirza TV. We also thank you very much for the transportation arrangement as well. School and Reliance School for arranging for the transportation. And thank you one and all for everyone. Thank you. Babu Media. Thank you very much. Babu Media too. And this program would have been a success without Zachariah and Tahir, especially she organized the welfare program. So on behalf of Ismail, Association, I thank you once again. Thank you so much. I would request you to kindly join us for the inauguration of the Rehab Center.
Assalamu alaikum everyone. Today we have achieved an incredible feat of over 50 screenings. I think you all deserve a huge round of applause for the incredible volunteers of SMI Association. Who Is Hussain Foundation, and all the Shia organizations. Just continue this jazbat. The real work has started now. Please don't think that the work is over. The real work starts after the medical camp. We'd like to thank the senior doctor fraternity, Dr. Mirza, who has been a great mentor to this camp, Dr. Jawahar, Dr. Hyderabad, Dr. Mirza, Dr. Hussain, and all the young doctors here. We have Dr. Salman from the dermatology department, Dr. Zainab, Dr. Rajab from Apollo Dental, and we have doctors, urologists, ENT doctors, and everyone. If I'm missing anyone, please forgive us. This is a great way of collaborating between the community doctors and the strengths of our community. Each doctor is an institution by itself. We have doctors working in different hospitals. For the first time, we have brought them all on one table. And this is the way to go forward. I wish you all the best, and also the SMI, Khadeem Azakhanas Association, Najiba and team. Thank you for this platform. This is a great beginning, and inshallah the youngsters, the youth of the Shia community will inshallah work in one platform. We also thank all the Arjumans, alhamdulillah, irrespective of different parts of the city, and over to the pre-care hub, which is the real work. Okay, today the patients in our community don't have a direction. We keep saying this again and again, but for the first time we have implemented a course, inshallah, through pre-care hub. You may be having family members in different parts of the city. Please reach out to us, and our expert team of doctors will go through the reports, and we will try our best to guide them. And we have the incredible support of Sama Foundation. Our brother Suhail Abbas was here and his incredible team. We will formulate a plan to work together, inshallah. Over to last few words by Ms. Tahir, and then we'll wind up and we will proceed towards the inauguration of the pre-care hub.
Before I would share a few words, I'd like to request Dr. Rajab to please come and share a few words.
Good evening, everybody. I hope all of you have become very tired. First of all, it's a holiday, and people are just relaxing at their homes. And see, we all have joined because we have pain in our hearts for doing something good for humanity. That's the reason. Whatever day you have spent this with us, it will be repaid by God Almighty. That's one thing. Second thing is, everybody is thanking everyone, but from my side, I will be thanking SMI as a Azakhanas Association for calling us and taking us as a part for this noble cause. Especially Najib, Dr. Zakaria, they have been working very hard to get, and we never expected a crowd of 300 on this day, when it's a holiday, and also there are so many people having so different engagements. And thirdly, I would like to thank all the volunteers who have joined here, especially the young ones who have enjoyed spending time with their friends today, but they have come here for some good cause, and it will be repaid for. And the last thing what I would like to tell is, let us not stop here. Let us continue. See, we are in the community, we are reachable. Almost everybody knows our numbers. See, the main thing, whatever message I want to give is, see, let us coordinate together so that, see, for example, like we have through experience, we have been many things. Whenever you are referring some patient or you have come across some patient with, as a volunteer, as a doctor, as anybody, just be in touch with us. See, for example, I would like to give you an example. Like if my father or my mother ends up with some problem at 8 o'clock or 9 o'clock, she is not able to lift her leg or her hand. So she calls me up and I have to take her to some hospital. Normally what they do is go to the nearest hospital, and usually see in hospital the working is very, very different. Usually the senior consultants are not there available in the hospital. So they are only on call. So the junior consultant or a junior doctor will put you across some treatment, admit, and then give some treatment till the senior consultant sees in the next morning. And many of them, because of undiagnosed, they land up into ICUs. So take our help. So whenever, see, for example, when they land up, we normally send to Nimas. Within 3 hours, the scanning, blood test, everything is done, the diagnosis is made. Then they go to the ICU or they have to go to any general hospital. This is we have learned out of our practice. Almost from 15, 20 years we have been doing any heart problem, we normally refer to some Jaidev or some setup where a diagnosis is made earlier and the patient goes to, he gets a regular, correct treatment and they can be referred to a proper place where they can get treatment. And today the main purpose of calling is preventive health where we have spoken about. And the second thing is coordination between government agencies and insurance companies. See, we are having lack of lacuna about spending money in hospitals because people end up in problems because of no money. So for that, this today was a very, very good day that we know that there are so many government schemes available and who will be eligible. At the same time, if you can afford, you can go for insurances as well as you can sponsor some relatives of yours for insurances so that we all do some good work so that and then lastly, many a times we as doctors we come across problems where patient lands up in the hospital and they get a call that we are not getting beds in that particular government hospital or the doctor is giving some diagnosis and the people are not understanding this. Every day to day we get calls. So we have been doing some work in this because we have a PRO with us who is unsung hero we can call it. Anytime he comes for our help, one he loves anybody not getting beds for delivery, if the patient is put in the corridor, we give a call and we have a coordination. He goes there, he was a PRO for Phenomenas. He goes there, he takes the whole history, everything on. He directly contacts the consultant and within hours we come to know what is going on there. And we have many a time we have received panic calls and we were able to solve the problems in the night overnight. We have not been delayed. So what we would tell everybody is, if at all you come across any medical problem, we are there 24/7 for you. We will help you where to go. And if at all you want the help of a coordinator, we will also send them. We will talk. If you have any problem with payment of bills, we will see what schemes, government schemes are available. These things can be helped. Our main cause is we want to help everybody. And I think you all also have joined us so that you want to help everybody. So thank you very much.
Thank you very much. I would like to start with all the volunteers who are right across me. The first member whose name I would like to take is basically Faryal, very deserving. And then she's the one who's the backbone of the association right now, managing the administration and the operations. And this whole medical camp would not have been possible without Inayat. Inayat Mirza started us. It was COB at the inception of this whole, reaching out to doctors, bringing out the doctors' mind circle, everything started with Inayat. If he wouldn't have given us all that, if he wouldn't have given that initial support and the pull, we wouldn't have reached here because this was absolutely not in the plan. We just telling you the basic. And then it got built when all the doctors came, they came and were very interested, we formalized the doctor circle, and then the horsepower came from Dr. Zakaria. So this is how we were able to, and then all the doctors, like each and every doctor came on board, then medical, the Summer Foundation came on board, and then we have Dr. Rajab with us, who's been there, who came right in the middle of the night to see if everything is going right. He made us choose the best from here and there. So it's a complete team effort. And now today we've had not just the association people, it is truly speaking, it's almost all the idaras put together. The Zahra, Anjuman is Zahra's here, where all the volunteers have come from far places and they've been through and through. Even now they're all sitting here. So my humble thanks to all of them. Now coming to thank the hospitals like Narayana Vidyalaya, Nedrudama, Dental Apollo is still continuing the dental practices down. We really thank each one of you for helping us. We thank Johnson's Clinic and Fatima Medicals, Rajab. Every 2 minutes we are calling him and he's sending us all the requirement medicines and the materials that is required here. We have a doctor who's come all the way from Rajab with his own dermatologist, his own kit of medications. So you see we have all coming together with passion together. And inshallah, I am very confident, we are very confident, all of us here are very confident that our next, inshallah, although we have prepared 100 plus people today, but inshallah, we will hit the mark of 100 in the next 3 months, in the next quarter. So our plan is to keep this very consistent, not just to start and stop. So inshallah, we'll see all of you and we will grow thicker and thicker and together. Thank you very much.